Genetic testing is everywhere right now, but beyond the headlines and social media posts, how do you know if it's something you should consider? If you've ever wondered whether your family history of cancer means something more, this discussion is for you. Hi, I'm Carrie Williams with Nothing Pink, and today we're excited to bring you an important conversation. We're talking about understanding your hereditary cancer risk. Today, I'm joined by Alexandria Diego, Oncology Medical Science Liaison with Myriad Genetics. We're talking about how genetic testing is changing the way we're understanding cancer risk and helping people make informed decisions about screening, prevention, and their healthcare. At Nothing Pink, our mission is to provide education, awareness, and support for people impacted by hereditary cancers. And we believe that knowledge can help people make informed decisions for their future. Before we get started, please be sure to subscribe to Nothing Pink's YouTube channel. Thanks so much for being with me today, Alex. I'm really excited for our conversation.
Thank you so much for that warm introduction. Again, my name is Alexandra Diego, and I'm an Oncology Medical Science Liaison, or MSL, with Myriad Genetics. I am located in Fort Lauderdale, Florida, and by background, I am a licensed and certified oncology nurse practitioner who specializes in cancer genetics and high-risk breast assessment and management. I have over 19 years of clinical experience overall, and my current role involves providing clinical oncology support to healthcare providers. So I, Alexandria Diego, am an employee of and shareholder in Myriad Genetics. Please read the following disclosures for this presentation. Okay, so we'll start with our objectives. During the first part of our webinar, we will understand the purpose and importance of cancer genetic testing. And we will also explore how tools like MyRisk Hereditary Cancer Test with RiskScore are informing personalized cancer care. In the first part of this webinar, we'll talk about what cancer genetic testing is and why it can help people who may be at a higher risk for cancer better understand their own risk. So firstly, what are DNA and genes in a nutshell? DNA is the long twisted molecule inside your cells that acts like a master instruction book for your entire body. And a gene is one small section of that book that gives a specific set of instructions to your body. Everyone is born with their own DNA and genes that they inherit from both of their parents. Chromosomes are neatly packaged bundles that hold all of your DNA together, so it can fit inside each cell. Essentially, genes tell the cells in your body how to make specific proteins, and then those proteins do most of the work in your body, which include building tissues, carrying signals, fighting infections, and preventing diseases such as cancers, as well as other diseases, and keeping everything running the way it should. Unfortunately, there are changes that can occur in your genes that can affect how proteins in your body do their jobs to prevent cancers. These changes are called genetic mutations. When a gene has a mutation, the instructions get a typo or a change, and because of that, the protein made from those instructions can come out slightly different or damaged and not work as well, which can affect how the body functions. This damage can affect how your body fights a disease, resulting in a lowered ability to do so. So if that protein normally helps control how your body's cells grow and divide, that mistake or typo can cause certain cells in your body to grow out of control, which is how a cancer can start. So when patients have a family or a personal history for cancer or get diagnosed with certain cancers, your healthcare provider may want to order a test to see if there are cancer genetic mutations. This is called germline testing. So germline testing is a type of cancer genetic testing that analyzes your DNA for a genetic change in every cell of the body. It's a way to check your genes that you were born with to see if you carry inherited risks for certain cancers. This test can be done by taking a sample of blood or saliva. Germline testing is needed to determine whether a person carries a cancer gene that they were born with which may put them at a higher risk for a cancer. About 1 in 4 women, which is about 25%, with no personal history of cancer will qualify for genetic testing, just based on their family history alone. And 10% of those women will test positive for a cancer genetic mutation. This information is crucial for preventing or reducing breast, ovarian, and other cancer risks, and offers valuable information for family members who also have the same mutation or other cancer risks. So looking for red flags in the family history, such as multiple cancers in the body, that means having different cancers in different areas, having cancer at a young age, such as those individuals who are diagnosed with a cancer at age 50 or younger, and having a rare cancer at any age, such as ovarian or pancreatic cancer, can help determine who meets criteria for genetic testing. Also, it's important to mention that many of the national cancer guidelines that doctors and healthcare professionals follow recommend germline genetic testing for individuals with breast and other cancers, regardless of what their family history is or their age. So let's discuss why genetic testing is so vital and important to patients. Genetic testing examines a person's DNA for gene changes and provides valuable and crucial information across the patient journey. So this is from their first risk assessment with their healthcare provider to cancer diagnosis, then treatment and survivorship and ongoing surveillance. While vital in all 3 stages of the patient journey, assessing a patient's risk for a cancer can help their healthcare provider determine the best way to manage their cancer risk and can also inform family members of their cancer risks as well. For patients with a cancer diagnosis, genetic testing can guide surgical planning, inform surveillance strategies for a second cancer risk, and support clinical decision-making. In addition, after surgery, genetic test results could help influence the selection of targeted drug therapies for patients diagnosed with cancer. Medical and cancer specialists now understand that germline genetic testing can play an important role in helping patients understand their cancer risk and guide their care. National cancer guidelines give recommendations for which patients should receive germline genetic testing and continue to update their recommendations to make testing more easy to obtain. So which patients meet these criteria? National cancer guidelines now recommend germline genetic testing for all patients diagnosed with ovarian, pancreatic, or breast cancer. And many guidelines now say that all patients with uterine or colon cancer can consider testing as well. Also, patients with a certain family history for breast cancer and family history of an ovarian cancer, a breast cancer in men in the family, Ashkenazi Jewish ancestry, and certain types of prostate cancer should also receive genetic testing. Genetic testing can show whether someone's cancer risk is inherited, which helps healthcare providers recommend the right screening and prevention steps based on proven guidelines. The MyRisk Hereditary Cancer Test looks at 63 genes linked to hereditary cancer risk to find genetic changes in people with a personal or a family history of certain cancers. This information helps healthcare providers create personalized care plans that can guide early detection or even help prevent a cancer. MyRisk with RiskScore gives a detailed, personalized breast cancer risk estimate or score for people assigned female at birth who have never had a breast cancer. Myriad's RiskScore also provides a personalized estimate of a woman's risk of developing breast cancer over the next 5 years and their lifetime. Therefore, the main takeaway is that germline testing and risk assessment together inform medical management decisions for patients with or without a cancer. Patients may be concerned with the cost of genetic testing. Myriad is committed to breaking those barriers in healthcare access. Therefore, cost should never be a barrier when providing care or when patients need genetic testing. Myriad is dedicated to making genetic testing available and affordable for every patient. We offer many options to help ensure all patients can access the care that they need. Fortunately, 95% of health insurers have coverage for genetic testing. And through insurance coverage and Myriad's financial assistance program, 90% of patients will have no out-of-pocket costs. Most importantly, if a patient encounters any financial hardship associated with their bill, Myriad will work directly with the patient towards their complete satisfaction. And from there, we will stop.
Wonderful. Thank you so much, Alex. I appreciate your time. And that was really valuable information for people to know, and especially that there are cost resources available. So many people have the understanding that genetic testing is extremely expensive, and thankfully that's been changed. And there's many resources available. So if you need assistance or have questions about genetic testing, reach out to Nothing Pink at nothingpink.org. Contact us. Thank you. Thanks for joining us, Alex.
Thank you.